Hi everyone, good afternoon. Today we are very honored, to have Dr. Lim Ziyi, who is a renowned haematologist, from CFCH. He has been practiced, for 20 years with experiences, from UK, overseas and also in Singapore. And he has got two clinics in Singapore. Well, today he'll be sharing with everyone, about blood health. So without further ado, I'll hand over to Dr. Ziyi, to start the whole talk. Thanks.
Thank you so much, Desmond. Thank you very much for inviting me on, and thank you everyone for making time on a Friday afternoon, to tune into this. So we're going to talk about blood health today, talk about your blood, and let's go through, and a few things we're going to go through in the next 20 minutes or so. I think the blood is a very important organ for us. We don't always think of the blood as an organ, we think of the liver, the spleen, the liver, the kidney, our brain, all these things are organs, but actually your blood is actually a liquid organ, but it's one of the most important organs in your body. So what we're going to do today is that we're going to talk about it in a few segments. We're going to touch initially, I'm just going to explain to you, educate you guys a bit about what the blood does, what's its function, why is it so important. We'll touch on a bit about how can you take simple measures to maintain your blood health, to keep yourself healthy from there, And finally, I'll touch on just a bit about what happens when your blood doesn't go well, doesn't function well. What are the things that can go wrong? And I'll share with you some cases that I commonly experience day to day from there. And I want this to be interactive, so please fire in questions if you have along the way. I'm happy to spend time afterwards answering questions, and Desmond will help me screen through them as we go along, So first thing, we're going to talk about what does your blood do, And when we talk about the blood, when we talk about the whole blood, we actually call it the hematologic system. That's what we tend to call it. And your blood is composed of three main areas, not just the liquid that goes around your body, but the bone marrow. The bone marrow where blood is made, that's in the body. Your liver is also part of your blood system, and your lymph system. Lymph system are these small glands which you have all over your body. And sometimes when you have things like coughs and colds, you feel that you're a bit painful, a bit swollen under your neck. That's your lymph glands which are swollen because they act as part of your immune system to kind of clear any bacteria or viruses in your body from there. So three main parts of your body: your bone marrow, your liver, and your spleen. And we're all familiar with that bone marrow because, if those of you who like eating nice chunks of beef with marrow with roasted marrow there, or if you eat a chicken bone, you can always see there's always when you look at a bone, there's a hard part of the bone outside, which is calcium, which is the hard part. But when you look at the inside part of the bone, there's always soft and fatty, and that is actually where all your blood is made. That's kind of the main factory of your bone, your blood from there. And the cells in that make different types of blood cells, and I'll go on to that in a while. But the key thing to note is that as you grow older, this gets more and more empty. So as you grow older, your bone marrow becomes more fatty, you have less cells there. So when you're 20 to 30 is a perfect age, you have good amounts of cells, and your machinery is very good. As you get to 60 and 70, you find that your blood and your marrow and your immune system tends to start slowing down, because I think part of it is a natural process. Part of it is, as we don't exercise well and we don't look after nutrition, the function naturally declines with time. So those are things that we have to take into account, particularly as we all age from there, to find out how we can do things to keep our blood system functioning better, and how can we find ways to make sure that our immunity stays active from there. Okay, so first thing I said, the blood's a very important organ. And as I said, we think of it just as a liquid, but this liquid makes up 8% of your body weight. So it's actually it's one of the biggest organs in your body. And when you look at the blood itself, so if you stick a needle and you go for a blood test quite often, when you take the blood, there are two parts to it. So if you take your blood and put it in a tube and you let it settle down, more than half of it is this thing called plasma. And the other half of it is this thing called blood cells, basically. So plasma is the liquid part of your blood from there. So it makes around more than half of it. Most of it is water, But your blood also carries a lot of important things such as proteins, carries glucose, carries your cholesterol. So the liquid part carries a lot of important things, including hormones, which helps your body's well-being. So that's the plasma part of blood. But the other part is the blood cells, okay? So when you do a blood test, and if you go for annual health checkup, the main thing that when you look at a blood test, it does is that it gives you lots of different values and looks at the blood cells inside it. And when you look at the blood cells and the blood report, there are three main things that you want to look at. You want to look at your red cells, you want to look at your white cells, and you want to look at platelets. These are the three important figures that I look at when a patient comes to see me from a GP. Those are the three first figures I look at from there. And why do I look at that? I look at that because there are there are functions that are most important, and these are the free cells that do the most important functions. So the first one is the red blood cell. Yeah, red blood cells, what they do is that they give you color, right? So when you are anemic, that's what they call 贫血. You start looking pale on your body. So the red cells are red, they're made from iron, and they carry oxygen in your body. Yeah, so they play an important part. When you're anemic, when you're tired, you don't carry enough oxygen, you start having problems with strain on your body and the rest of your heart. So the red cells are important. The second part of your blood counts are your white cells. Yeah, your white cells are what I call the soldiers of your body. They help you to fight infections from there. So when you have an infection, they tend to be very high because your body has an immune response to fight infections. But sometimes when you have certain infections like viral infections, the white cell count can be pressed down by the infections as well. Yeah, but either way, white cells are very important. If they go bad, sometimes that's when people get conditions such as cancer or leukemia from there. And the final thing is platelets. Platelets are these little dots in your blood. Yeah, platelets are important because they help your blood clot. Yeah, and when your platelets are too low, then you can start getting bleeding and problems. And one of the common causes at the moment where we see this at the moment is due to an infection that we're all familiar with, not COVID, but dengue fever. Yeah, so everyone's focused on COVID at the moment and talking a lot about COVID, but actually we don't see much COVID cases in hospital at the moment. We see a lot of dengue. There's a dengue epidemic at the moment. And when you have dengue, it's a virus which actually causes your platelet count to drop quite low from there. So patients who have very severe dengue shock, and we're seeing quite a lot recently, their platelet count can drop very low and they can have problems with bruising all over and bleeding. And sometimes we actually even have to give them platelet transfusions to support them from there. Okay, so you have your red cells, your white cells, and your platelets, all of which are important components of your blood system. And we have a lot of them. So again, if you look at this fact, which I always say is very interesting, is that if you take a drop of blood, you find that you actually have a lot of red cells, 5 million red cells, almost 10,000 white cells, and almost 300,000 platelets in your blood, one drop of blood. So it's an amazing organ, the blood, from there. And lots of different cells are packed into one drop of blood. And the blood system, again, why is it so amazing? If you look at it, one drop of this red blood cells, one drop of blood, which I showed you just now, it just takes it 30 seconds to go all around your whole body. Yeah? So you have a very dynamic, active organ in your body called blood, which circulates around, and it does all these incredible functions from there. And I said, this is a system of the circulation of the body. And the blood is a very important transport organ from that point of view. Yeah. So what does it transport then? So I've told you the components of blood, but what it transports oxygen. Yeah, it's important. The red cells transport oxygen to different parts of the body. Yeah. It helps you to form clots. Yeah. So if you cut yourself, bruise yourself, the platelets form clots to prevent you from bleeding from there. It helps you fight infections. So again, if you have anything from COVID to dengue fever to a common infection, it's your white cells that help you fight infections. Your blood also cleans your body. Yeah. Although your liver and kidney are the organs which actually do the filtering, your blood is the organ which shifts all the toxins from other parts of body to your kidney and liver. Yeah. And finally, what's important as well is your blood, by moving that fast around and going to the surface of the body, helps to control your body temperature. Yeah. So there are 5 very important functions of blood. And it's so important. And that's why if anything goes wrong with any part of your blood, it can affect any of these things. It can affect you in terms of carrying oxygen, affects you in terms of infections, it affects you in terms of having bleeding, building up waste problems, or even a fever from there. So the blood is a very important organ due to all these reasons from there. Yeah. So that's a bit about what blood does. So how do you maintain your blood health then? Yeah, so there's some simple measures you need to do for that, because I think why? Because as I showed you, the blood is a very active organ. Yeah, it's a very big organ, and with so many cells in your blood, the cells are turned over very rapidly. Yeah, and it's one blood, just like your hair, just like the lining of your mouth. These are cells which grow very rapidly, and so if you do not feed your body well with the right ingredients, yeah, your blood production can drop very quickly, and your immune system can drop very quickly, and sometimes you can get problems with bleeding, bruising, or infections very quickly. So it's important that you maintain your nutrition from there. And what do you need to feed your body? Yeah, you need quite a lot of different nutrients actually, but I'm just going to focus on 3 main keys here, 3 main things that everyone should look at. These are the 3 ingredients we always check to see if someone as well. So sometimes GPs refer patients to me with blood counts being slightly low, abnormal, people having slightly tiredness. And these are one of the 3 key tests I do, simple tests I do to make sure that patients are well nourished and they have enough key ingredients for their body. So the first one is iron. I think a lot of us are very familiar with iron from there, and I'll talk a bit more about that later. But the other 2 things are two sort of like mineral vitamins that we need, folic acid and vitamin B12. Yeah, these are 2 building blocks that we need for blood. Folic acid is something that is found in a lot of fruits and vegetables. So this is an important thing you look at from there. So certainly, there are certain situations sometimes where you need more folic acid. So like say if you're pregnant or you're expecting, we always ask the pregnant women to take more folic acid. Why? Because folic acid is an important ingredient for cell growth. It helps in growth of the nerves of a baby, but particularly blood as well from there. And in a pregnant woman, for example, you need to make blood not just for yourself. And so when a woman's getting pregnant, as a baby gets bigger, she needs to make much bigger blood volume for herself. But at the same time, you need to make blood for a baby. So you need to feed yourself with the right ingredients. So folic acid is very important. Yeah, there are tablets you can take sometimes, but the best thing to do is always focus on your diet. So it's a good, balanced green diet is very important from here. So folic acid, very important from there. When patients ask me what should I take for eating, my general rule is say go and search on the internet. Yeah, internet's a wonderful thing nowadays. And part of the reason why I don't lecture people on what exactly to eat is that nowadays we are in Singapore, we're blessed with a choice of foods, but we're also very sophisticated palates now in Singapore. So I always say go to the internet, have a look at all the lists, pick and match what you like for your diet, and try to have something that you can sustain and eat from there. Yeah, because some people just can't stand asparagus, and if I ask you to eat asparagus every day, you kill me. Yeah, so pick what you like to eat and do it from there. But folic acid is very important. The other thing to do is B12, vitamin B12. So it's very different. These are 2 very different type of vitamins from there. Folic acid, I said before, is vegetables mainly. B12 is also very important. But B12 is not found usually in vegetables. It's found in meat substances. So again, it's like things like shellfish, liver, fish, crab meat, cheese, dairy products all have a lot of vitamin B12. Yeah, so you need to have a balance of these 2 different things. Some people have no lactose intolerance and other things, so you then have to adjust it from there. Some people are have a particular gut condition called pernicious anemia, where they just cannot absorb vitamin B12 and folate from their gut. So sometimes we see that where we have people who are just very anemic, whose blood counts are all very low, and it's because their gut cannot absorb this. And we do a blood test, we find that their B12 and folate acid levels are low. So sometimes if it's very low, diet may not help in those cases. In those cases, if it doesn't help, we may have to give supplementations, including injections and things. But that being said, most people, I think if you have a good balanced diet, you should be adequately replaced for these things. Yeah. The other thing to bear in mind as well is that nowadays in Singapore, when most people, if you're young, you're healthy and active, you tend to be fine. A group which we worry more about is actually older people. As people get older and sometimes they're more isolated, they don't eat well enough, quite often they then suffer from B12 and folate deficiency because they're much more picky, much more 挑食, they just end up having a lot of these things which build up slowly over time from there. So again, if you have elderly members of your family, it's good to make sure that they have a regular balanced diet from there. And if they really can't eat, the other thing to think about sometimes is taking some vitamin supplements which are high in B12 and folate. Again, there are lots of supplements you can get from Watson's, from Guardian, which have that as well. Okay. So that's that. So my last bit, I just want to share with you a couple of cases of blood health and what happens when your blood does not function well. Yeah. So the blood's a very important organ. And as Desmond mentioned earlier on, in my day job, I'm actually a cancer specialist. Yeah. So I deal with blood cancers mainly from that point of view. And I run a very big bone marrow transplant program in the private practice there. But I think blood cancers tend to be quite uncommon, I'll be honest with you from there. Yeah, they're very serious, some of these cases, but they're less common. So what I'm going to talk about is some of the more general things we tend to see, some things that people tend to worry about, and we take it from there. If you have more specific questions about specific types of cancer later on, we can always discuss that later. But this is one of the most common things I get referred for. And when I see this probably a few times a week, someone gets referred to me, either by themselves or by the GP or by the ONG. And typically is this, a woman who is in childbearing age, yeah, so is still having monthly periods, comes with heavy periods, and picky eating is not uncommon nowadays, partly because, everyone is so busy at work, everyone wants to look good. And when you're working at long hours, many people start neglecting their food from there. Yeah. And quite often we get, for example, this 40-year-old female comes to me, having seen the GP with hair loss, tiredness, and getting more and more breathless on exertion. Yeah. So more and more tired when doing it. This is a common feature we see all the time. Yeah. And quite often, just even before doing my blood test, I can tell you what the answer is. And this is what a blood test, a full blood count looks like. Yeah. So many of you, if you're having yearly health checkups, one of the key tests you always look at is your hematology or your blood count from there. Patients always come to me asking lots of questions because there are a lot of fields here that people look at. Yeah. But as I said before, again, there are only 3 key fields that are important that we tend to focus on initially. So usually I say don't get too caught up with the nitty gritty of the other areas. Always look at your hemoglobin, which is your red cell count, your HGB, your white cell count, and your platelets. Those are the 3 most important informative parameters from here. So if you look at this patient, the white cell count, WBC, and the platelet count are normal. Yeah. What is abnormal is the HGB, the hemoglobin of the red cell count. You can see it's 7.5. Yeah. A normal person's red cell count is between 11 to 16. Yeah. So this patient is very anemic from there. Yeah. 贫血症. So the blood count is probably around 70% or 60% of what it normally should be. The other thing I tend to look at, and this is something that you sometimes look at, is this thing called MCV. MCV is a test which looks at the size of the red cells, yeah, how big your red cells are. So normally a red cell should be a good sized red cell, and a healthy person should be around 80 to 90. In this case, the patient's MCV is 64. So it's small. So someone in this patient has not enough blood. One, HGB is low. Secondly, the MCV is also, all red cells are quite small as well from there. And what does this mean? This almost certainly in these cases means that this patient has iron deficiency anemia from there. So this is a picture that we tend to do. When we do these tests, quite often we take a sample, we look under the microscope, and we have a look at the red cells from there. And in a normal person's red cells here on your right, you can see the red cells are all nice and red and nice and round from that point of view, all quite even. There are a lot of them. In someone like this lady, for example, you can look at the red cells here. They're all quite pale. Yeah, they're quite pale, and they're a big circle of, they're all quite pale, a bit smaller, and you can see there's a lot of white in the middle rather than red from there. So this is what happens when you don't have enough iron, because you need iron to make the hemoglobin, which is a red bit in the cells. So you don't have a patient is iron deficient, they're not making enough red bits to support the red cells. So the red cells get small and they get pale from there. So this is iron deficiency anemia. And iron deficiency anemia is a very common problem from there. And I always do some extra tests there to confirm the iron deficiency anemia. I check the iron levels of the patient from there. If you look at this, you can see the iron levels here is 1. Yeah, so a normal person's is 6 to 27, and the iron level here is 1, so almost nothing. And some of you may say, wow, that's very low. But actually, I see it is very common. As I said, once, twice a week, we get young female coming in with an iron level, which is almost like this. And quite often, as I said, I don't need to look at the blood test. By just getting a history, we can tell that this is a problem. And even when you look at the ferritin, which is 铁蛋白, which is another measure of iron in the blood, you can see it's 1.7. Normal persons is 10 to 200. So this patient is very iron deficient from there. Yeah. And as I said, it's a very common problem, particularly in women. Mainly in women. Why? Not because I'm sexist or anything, but women, particularly of childbearing age, they get their monthly menstrual cycles. And because of that, they lose a lot of blood and a lot of iron from there. Men, on the other hand, don't tend to get so iron deficient. We don't see it. 90% of the women, people with iron deficiency tend to be females. And it's estimated that probably up to 20% of our female population are iron deficient to some level or another. So it's very common, and quite often we see women who come to us who say, I've been tired all my life, yeah? And there's a reason for it. Sometimes people just think it's, because I'm busy, I've got children, I've got busy work. But actually, many cases, this is that the blood levels are not optimized. And actually, if they take the right measures, you can optimize it and you can improve your daily performance function from there, performance function, yeah? So what happens when you're iron deficient? Yeah, when you're iron deficient, you get tired, you get fatigued, you get poor concentration sometimes, loss of appetite, dizziness, headaches, disrupted sleep, even hair loss. So in fact, one of the things I quite often get seen is quite often my skin doctor colleagues send me ladies who they've checked because they've gone to people have gone to the skin doctors with hair loss. And it turns out these women are iron deficient, and when we rectify the deficiency, the hair comes back from that point of view. So it's again one of these causes where it affects a variety of things from there. Yeah. And why do you get iron deficiency? Two things, very simple. It could be either you're not taking enough or you're losing too much from there. Yeah. And how is it that you lose too much? As I said again, the main reason for this in women of childbearing age is menstrual bleeding, your monthly cycle. And so we always have to ask this, how heavy is your monthly cycle? And we go into quite a lot of details from that point of view, because if it's very heavy, you can imagine that if you're losing X amount of iron every month from that, and you don't take enough in return over a period of time, you're definitely going to become quite anemic from there. The other cause of iron deficiency and from bleeding can sometimes be bleeding from your gut. Again, we take history. So if you've been passing history or passing about dark stools, gastric pains, it could be that you need investigation. For most women, it tends to be menstrual bleeding. But for males, if you have iron deficiency, anemia is not normal. And usually we would then have to arrange for you to be seen by a gastroenterologist for further investigations from there. But you could lose too much, but sometimes you just don't eat enough as well. And what happens if you don't eat enough? If you could be because one, again, you don't have enough iron in your diet, or two, some people just don't absorb enough iron from there. So how do we then treat the iron deficiency? Yeah, we try to find out why you lose the iron. We improve your dietary intake. But some people, even with a good diet intake, just like the lady I showed you, she's got such a bad iron deficiency that we have to give them a supplement. So quite often we give them oral iron tablets. Yeah, oral iron tablets are easy to take. They can be a tablet or can be liquid from that point of view. People sometimes can get constipated and unwell, but most people tolerate it quite well. Finally, there's a small proportion of people who need intravenous iron. That's where we get a bag of iron in the liquid and just inject it into the blood from there. Yeah, there are some practices, GP practices, who are now offering regular iron transfusions to people. I know, but it's something that we try to avoid if we can. There can be side effects if you give too much iron to a person. It can be quite painful if you give it wrongly. So we try not to give IV iron upfront unless people fail the other measures first. But sometimes if you have someone who's very iron deficient, very anemic, we will give them IV iron as a quick boost to get them better quickly. And the sources of iron, again, you can take it from meat. And people always think about iron as taking it from zukan, red steaks and everything. But I always say that no, a lot of iron can be taken from sources which are from plant-based, because actually, if you think about it, a lot of vegetarians are not iron deficient from there. So this is again to show you that it doesn't always have to be red meat, doesn't always have to be liver, because all those things are quite high in cholesterol, not so healthy. So there's a whole range of vegetables you can take which can boost your iron stores from there. Okay. So the second case I want to show you again is a different end of the spectrum. So again, this is a case which came to me around a year ago. Actually, is a 78-year-old female the GP sent to me with a bit of anemia, weight loss, fevers, and swollen glands all over. Yeah, so I told you before, sometimes your glands can get swollen. Your lymph glands are your defense mechanism against infections. Infections get pulled there and get treated. So when you have glands all over, sometimes we think, could this be infection? When you have a fever and weight loss as well. Yeah, so we saw her, I did a bit of assessment, and indeed she was a lady who was very well before and was just gradually losing a lot of weight and have a fever. And when something like this happens, we always worry. One, could this be bad infection of some sort? Or we also worry, could this be some form of cancer from there when this happens in an old lady from there? And we look at it, has she got swollen lymph glands? And this is a different picture, but you can see this is a picture of lymph glands. And if you look at this chest x-ray where the arrows are pointed, you have big glands in your chest as well. Sometimes when you have either lymphoma or other problems, they can be swollen. So questions to ask, because I'm sure all of you have felt swollen lymph glands in your body once in a while. And this is something I mention to GPs when I see them often when they ask me what to look out for. You always ask, for example, is the lymph gland a lymph node or is something else? Is it a cyst or something? Is it enlarged? Yeah, so usually you don't feel lymph gland. So if you can feel anything, it's enlarged. Yeah, but is it enlarging? Is it getting bigger? Is it very hard or soft, for example? And one of the key things you want to ask, is it one side or both sides? Is it all over your body or just localized from there? Yeah. And There are many things, reasons why you can get swollen glands. Okay, as I said, it can be infection related. It can be things like if you have an immune disorder, cancer is one thing we always worry about, and sometimes some drugs can cause it as well. So usually, if you see a doctor, we'll have to take a very detailed history to work out what it could be. But this is the picture of this lady. So because she had such swollen glands all over, I was worried that this could be cancer. Yeah, from there, a lymphoma as well. So we put her through a machine from there called a PET scan. And what a PET scan does is that it's not just a scan of the whole body. We inject her with a special dye, and this dye has a bit of glucose in it. So anything that's active in the body sucks up the dye from there and will light up. So you can see in this case, all the black dots in this lady's body, this is the neck, the armpits, and the groin are all lit up from there. So there's clearly she has something very active here that's sucking up all the dye from there. And when you look at this, there are two, you always worry, could this be a cancer? And many people see, could this be a cancer? Many of my colleagues see this will be. And so you worry, could this be a cancer? Could this be something like lymphoma? Because all these spots are lit up our lymph glands. So the only way to confirm it is to do a biopsy. Yeah, because PET scan just tells you the picture, it doesn't give you a diagnosis. So I got one of my ENT colleagues to stick a needle into the neck. You can see here where it's very hot. This is the best place to go to get a biopsy. And lo and behold, we guessed it. Actually, it was not cancer. Yeah, very good for her. It was not cancer. Actually, she had TB, tuberculosis. Yeah. So sometimes, that's the reason why you have to do a biopsy. You have to check before you do anything else, because sometimes you just cannot tell from these pictures what it could be. Because if you ask me, many times this could fit with the picture of lymphoma, but once in a while we see patients who have a similar picture and this turns out to be an infection. Of course, for her, that's the best outcome, because if it's TB, you just need to take drug therapy for 6 months and you're cured from there. And sure enough, after 6 months, once she started a treatment, within a few months, the fever settled down, her weight started going back, and after 6 months, she was completely cured. So this is an example of what lymph nodes are and how we assess it. But when should you go and see us, for example, if you're worried about it? So I think if you have a lymph glands which are swollen for 3 or more weeks, one. Two, if your glands keep increasing in size, yeah. So what's a good size? So anything greater than 2 centimeters, we worry. If it's half a centimeter, small node, quite often we say watch it for a while. But if you have lymph node which is 2 centimeters and more, increasing in size, certainly you probably have to see at least a GP from there. If the lymph nodes are swollen all over, that's the other thing. And then if it's associated with other things, such as night sweats or weight loss from there, because if you have night sweats or weight loss, it tends to be something more serious. It could still not be cancer sometimes. It might still be something like infection, but sometimes it can be related to cancer, okay? So quick thing on lymphoma, which is cancer of the lymph glands, is the most common blood cancer in adults, yeah, we see. And the most common cause, unfortunately, of blood cancer death. And this is a type of cancer that's increasing by 4% every year in the population. We don't know why it's increasing, yeah, but across the world, be it in Singapore, be it in Australia, be it in the US, the incidence is increasing, yeah. And when you say lymphoma, most commonly, I said you see the lymph glands, you may see night sweats, you may see weight loss, but there can be other symptoms as well, like a rashes, low back pain, and some reason for some types of lymphomas, if you drink alcohol, the lymph nodes get more swollen. So these are things which sometimes can lead to us saying you need to have further investigation from there. And as I said, even though the incidence of lymphoma is increasing worldwide, the outcome is getting better and better. And that's one of the important things. So nowadays, for many forms of lymphoma, even though it's very common, the treatments, one, are outpatient based. Many patients don't have to be admitted to hospital. And two, the treatments are very good. So complication rates are very slow with lymphoma treatment. And the 5-year survival is anything from 60 to 70%. And for some forms of lymphoma, can even get closer to 90 to 100%. And as I said, depends on the type of lymphoma from there. So if you're looking at the lymphomas on your right-hand side, things like high-grade lymphomas and Hodgkin's lymphoma, you're getting cure rates 70 to 80% from there. So I've not touched too much on blood cancers, hematological malignancies. Why? Because they can be rare and sometimes quite complicated. So we talk about lymphomas, leukemias, and there are almost 60 types of blood cancers from there. And there are many different subtypes. So patients always say, how come my treatment is different from someone else? It's because there's so many different types of blood cancers from there. So I won't touch too much on that. I think the only point I want to make to you is that if you touch wood, if you know anyone who has problems with this, one of the key things about blood cancers is that you need to have an accurate diagnosis and classification before you even start treating. Yeah, so the discussion of this is more for another day maybe, but just to say that diagnosis of blood cancers is a skill in itself, not easy, and it's important to do well, because if you get it well, it makes a big difference and impact on the patient, and quite often it has a big impact on how we treat the patient, so that we can treat the patient in the most effective and the most economical way from there. Yeah, so that's me just quickly touching a bit about blood cancer at the end of it. Yeah, so I think that's me reaching the end of my talk. Yeah, so just to summarize again what I've been through, I've talked to you a bit about what your blood does. I mean, how your blood is a very important organ. I talked about the ingredients that you need to feed your blood to make it well. And I think that includes the three main ingredients, iron, uh, folic acid, as well as vitamin B12. And finally, I gave you some examples of why sometimes your blood doesn't go well, and some things about if you're anemic or if you have swollen lymph nodes, why sometimes it's important that you come to seek help or attention from there. So with that, I'll leave on this slide. As Desmond said, we have two clinics and function, one in Novena and one in Glen Eagles. Thank you very much. Yeah.